Hello everyone, this is Dr. Pavan.
Hi everyone, this is Dr. Prabha. In today's video, we will be discussing shin splints. We will go over what they are, how to treat them, and we'll give you some helpful tips on how to manage them.
We'll start off with the anatomy first to better understand how shin splints occur. So in the area of your lower leg, where your shin is, there are three major muscle groups: the front, the back, and the outer side. So these muscle groups work together with controlling the ankle and the foot motion. If there's any imbalance in the strength around the area, some areas of those muscle groups will have to work harder. And in this case, if it is the front muscle group or the back muscle group that's working harder than the others, it can start to cause repetitive friction near the bone, the shin bone that is, and then that can lead to some micro trauma and inflammation. In this case, over time, something similar to running, which is a repetitive activity, that repetitive motion and friction can cause inflammation and pain, and therefore you get the shin splints as a result.
Before we begin to manage shin splints, it is important to assess and rule out a tibial stress fracture and compartment syndrome. After this, an in-clinic treatment plan would normally involve promoting tissue healing, proper muscle activation, and sometimes even taping. Things you can do at home are to change your footwear, as we discussed in episode 2. Footwear can also have an impact on how your body reacts to the forces that we put through it. If you have been prescribed custom-made orthotics and you have them with you at home, it is a good idea to use them. We don't recommend prolonged use, however. Think of your orthotics as a device to help you until you're able to change your movement patterns and strengthen or activate the muscles responsible for making the needed changes in the feet. They can help you provide temporary relief of shin splints and help support the intended motion of the foot.
So going back to those three muscle groups that I brought up earlier, you want to make sure that there is balanced strength across those three muscle groups. So you want to address any weakness in the area by strengthening the opposites accordingly. So in this example, when shin splints occur, if you feel it at the front of the shin, then that muscle group at the front of the shin is probably working too hard. So we want to try to offset that and help out the weak muscles opposite to it, which is the muscles at the back of the shin, as an example on how to approach it. Another thing you also want to keep in mind is your general motion of the joints in the area. If the joints aren't moving well, the muscles around them have to work harder. So you want to make sure that your ankle joints are moving well and your foot joints are moving well accordingly.
We hope you had a fantastic time learning about shin splints and gained some valuable knowledge to help yourself either prevent or manage shin splints. In the next video, we will discuss plantar fasciitis. If you found this video helpful, give it a like, and if you want to see more from us, hit the follow button. Stay tuned.